Hi, this is Brian Wilmers recording a lecture for the assessment of the gastrointestinal system for medical surgical nursing. These are the learning objectives that I'll let you read through on your own. Points to know about the gastrointestinal system is that it goes all the way from your mouth to your anus, including mouth, teeth, salivary glands, esophagus, stomach, gallbladder, liver, intestines, rectum, all the way down. And what it does is it works with secretion of digestive fluids, works on digestion, works on absorption of nutrients and minerals, works on motility for moving that food and that waste product, and then, of course, elimination of that waste product. So some subjective assessments that you might want to know about your patient would be the history. What's their age, what's their gender, what's their culture, and how does that play into their ability to eat and have excrement. Any previous GI disorders in the past that we should be aware of, or any surgeries in the past we should be aware of. Any current medications that they're on that might have an effect on this. Either that's strictly for a GI thing or might have a side effect causing GI problems. Any travel history into a foreign country, because that will expand your diagnosis as to what's going on with your patients. What's the nutritional history? What's their diet? Any food allergies? Are they having any anorexia or dyspepsia? What's the family history? Do they have a genetic risk that they might be at for, things such as colon cancer? What's their current health problem that brings them in? What are their symptoms? What have they done to treat it? What have they tried? How long has this been going on? What's their pattern of bowel elimination? What's their weight? Has that been stable? Some objective assessments. So things to help you out, make sure that they're laying flat, have their knees up and bent so you can actually get a good feel of the abdomen. Have them go to the bathroom prior to doing your assessment so you can actually feel the structures inside. Remember, start right upper, left lower, and then right lower quadrant. Make sure you guys are doing your auscultations. So inspection, then auscultation, then percussion, and then palpation. Diagnostic tests that we can be doing for the GI system includes laboratory studies such as liver enzymes, EGDs, which is a scoping procedure, upper and lower GI, which you guys will see hopefully in endo, barium enemas to look and see at the structure, MRCP, which is magnetic resonance, versus ERPC, which is endoscopy, so that's taking a scope. And what you're doing there is you're looking at the biliary tree. We can do percutaneous transhepatic cholangiography, which, once again, it's through the skin and looking at the blood flow. CT is a series of x-rays that we're looking at different structures. Endoscopy is taking a scope and direct visualization. Ultrasound is going through the skin and seeing the different structures and how dense they are. A liver spleen scan is similar to that. Small bowel capsule enteroscopy is when they swallow a small camera. It looks like a little capsule. It goes through the system. It takes snapshots as it goes through, and then it records that to a little belt that they wear that records it via Bluetooth. They do not need to turn in that small capsule after it passes. And the last one here on the list is the pH probe. And the pH probe is like an NG, but it's got sensors that go different heights above the stomach. And so with that, you can see how acidic the stomach contents are. If they have GERD, how far does that GERD go up? And if that goes up, how acidic is that reflux that they have? Some changes that people will have with aging related to GI system is that as they get older, they have decreased hydrochloric acid production. They also have decreased peristalsis, and they can have increased fibrotic tissue, which can cause complications with constipation and obstruction. That ends today's lecture. If you have any questions, please contact me.